Today, we are very pleased to host a special guest and colleague of mine, Dr. Gary Slutkin. Many here know I've been a violence scholar above all, and taking a public health approach. I have had the chance to interact with physicians and experts of all different specialties and sectors, from trauma surgeons and anthropologists to representatives of government. And Dr. Slutkin has been one of them, pioneering and setting the tone for global innovation. We met in Geneva at a World Health Organization gathering around 2011, and Dr. Slutkin had already tremendously influenced my work, if not become a guiding principle for it, for his extraordinary insight in approaching violence as a contagious disease. And now we both apply the same principles to tyranny and authoritarianism. His biography is a bit too long to give justice here, but briefly, Dr. Slutkin is an epidemiologist and infectious disease specialist who began his career combating tuberculosis and cholera epidemics in Somalian refugee camps. He then was recruited by the WHO to become the director of intervention and helped to reverse the course of many epidemics, including AIDS, in 25 countries in East and Central Africa, Latin America, and Asia. Upon returning to the United States, he wondered if gun violence could be treated like an epidemic, using the principles of public health. And the rest is history. The Department of Justice and the Centers for Disease Control through Johns Hopkins University validated the work of his organization, Cure Violence, and his methods were replicated in dozens of US cities and in many countries abroad. You can hear an excellent illustration of Cure Violence Global, in fact, in his TED Talk, which I encourage everyone to watch. A link will be found in the newsletter for today. Dr. Slutkin is one of the go-to people for epidemics around the globe, be it SARS, Ebola, COVID-19, or the dangers in North Korea and Ukraine. So, so I will now turn it over to Dr. Slutkin to describe his work as well as how he believes his lifelong studies apply to the current situation we are in today. So, Dr. Slutkin?
Yeah, well, thank you, Bandy. So I have an open book to start anywhere I want. So yeah, thank you for the introduction and thanks for inviting me. So yeah, my story and my view is one of contagious diseases and infectious diseases. I'm not an academic, although I was at a university for a long time. I'm primarily a practitioner, and I became a practitioner of how to manage epidemics. And as Bandy said, when I came back to the US, I saw violence in this country. And as I looked at graphs and charts and basically the behavior of the phenomenon, it looked to me exactly like all the other stuff that I had been managing. In other words, it looks exactly like a contagious disease and it behaves in that way. And it meets the definition of disease because it has characteristic signs and symptoms. We can all recognize violence. It's very characteristic. Um, and it is contagious in that it causes more of itself. So I'm just clarifying the reality that violence is, in fact, a disease process. And the work that I've been involved with in the organization has largely been around community violence, although we've also, worked in cartels and tribes and in conflict zones and worked on some interruptions having to do with um, even a couple of war situations, not always successful. The uh, the relevance of this to now is, of course, because violence is everywhere, but they all behave the same, all of the what I call syndromes. So people are used to thinking about community violence and mass shootings and violence in the home and child abuse and war and suicides, but they are all one. They're all the same disease, just like bubonic plague and lymphatic plague and pneumonic plague and so on. They're all transmitted the same way. and they all operate the same way according to exposure and susceptibility. So the more you're exposed to violence in your home or in your neighborhood, the more likely you are to do it. But that transmits across these syndromes. So if you're exposed to violence as a child, you're more likely to not only do it to your own children, but to in your community or home or to commit suicide. So 7 of the 12 syndromes actually go cross syndromes. So the reason I say that is that it's confirming that it's one disease showing up in different ways. Now, what we're seeing in this country at an enormous scale is something that I've begun to call authoritarian violence disorder. And so I'm seeing it as simply another syndrome and or a strain, and obviously one of the most lethal and dangerous and most contagious because it spreads across a whole country and it spreads outside of the country. And it's what we're seeing in this country is without a doubt a cousin of the 20th century phenomenon that have caused the worst mass death situations in human history. So this is the same phenomenon. You could call it a relapse in that it's in a different geographical area. You might just say it's relapsing somewhere else, but it's the same phenomenon. And so it operates the same way. I mean, there is an index case, and in fact, more than one index case, which is a very visible um, individual. But there's many because there, as we can all see, there's spread occurring at multiple levels, not just at the top and from the top, but it's we're seeing the violence appear in cities around the country that are a result of it. For example, the ice raids. So this is I just want to emphasize one very important point, which is that I don't see this as a political phenomenon. I don't see it as a moralistic phenomenon. I see it as the way violence works. So scientifically, this is violence taking over a situation, as plague took over 14th century Europe. Violence can take over a community or a country as war has taken over, for example, Gaza. So I see violence as the primary mover, moving the way that it moves. Now, that to a certain extent, and I've always spoken about this in this way, the fact that violence is an epidemic disease and we understand the way it's transmitted, although we sometimes use different words, it's actually good news because we have a standard epidemic approach that we move from, so you work on TB, you work on cholera, you work on malaria, and then you get assigned to violence. You're still doing the basics. And the basics are that we need to understand the disease and we need to do active case finding and interrupt the spread. I want to just say before going into the aspects of the interruption of the spread that some of the things we're seeing, how they fit. So here we have a very high level of exposure. And the exposure is through, of course, media and influencers. But there's, it's like COVID, the more you're exposed, but you're also susceptible. So you have to be exposed, but then it's the susceptible people who get very, very sick. So in COVID, we know it's the older people and other people with metabolic problems. In here, it's people with a lot of pain or who have some, I don't know, you could say personality types that are very easily brought into an obedient modality. more likely to. And the dehumanization enhances the susceptibility. And because it kind of relieves the pain, that is the susceptibility. So it motivates that direction in an individual and in groups. There's a lot more to say about this, including the way lies work to confuse you. So um, I think I want to go through the playbook a little bit, knowing that I'm missing some things that maybe it'll show up in questions and so on. One of the most important things for managing an epidemic is that people understand it. So this is to be re-understood, in my opinion, as an illness. It is a disease. So, and a contagious phenomenon. So that's different than right or wrong or good or bad. It's different from. It's not an easy move for people. For myself as well. The next is to do what we do in epidemics is active case finding. So you're looking for where spread is happening. Wherever violence is happening, spread is happening. So, and this is the main thing, is to stop the spread. So where the spread is coming from is where interaction needs to be made in the way of either persuasion or other ways of changing the interpretation of that so it's no longer as powerful a spreading phenomenon, almost like, closing a pipe or manipulating it in such a way that it's no longer as toxic. There has to be some form of systems for this because the way to access points of, if you were to think of people at the top or people around the people at the top, the people who need to interact with them are people who have access and credibility and trust, who are in a way trained to modify that situation or those individuals. That's quite a skill. And not everybody wants to do that. But the reality of this, and I'm talking not just about in this country, but there's other individuals and locations that you can put in your mind in other countries where there's this kind of spreading where their own country is getting messed up as well. So at the local level where there's spread, for example, where there's raids, the same thing is relevant, is that, and I haven't yet mentioned the relevance of pushback. So, and Bandy, you've talked about this so many times about, see, when violence gets moving, because people want belonging, they want acceptance, and then they want acknowledgement, and then they want status, and then they want power, it moves to cruelty. So that's kind of what the dopamine ladder. And then it's almost like an addictive process. So what I'm trying to get to here is that we should be focusing on the violence and the cruelty and pushing back on that more than we're pushing back on the individual or individuals.
That's right.
So I think I'm going to stop there, except to just place mark one thing, is that these things of this scale are operating with a story. Gangs have a story of their history and how they've been victimized. And countries have stories. Like Germany had a story after World War One. And this is operating with a story, also a similar story of being of victimization and of and a scapegoating story, as if the cruelty done against this group, and then it'll be more, and then it could be more, alleviates that pain. And we need a different story than that.
It's the exact same story I've encountered in maximum security prisons, even decades before Donald Trump came about. And it's the same phenomenon that has occurred through history. And I really appreciate how you characterize this as a syndrome and as a medical issue, a health issue that should not be pinned on any particular individual, even as or in my case, I have spoken against the dangers of a particular individual, but I've also emphasized over and over that it is a public health matter that we need to take out of simply particularizing to an individual or our time. So thank you so much for that speech, and I think you do bring a great deal of hope in that we have this epidemic approach, and that's what I've also tried to emphasize as well, that we do have solutions. We have done this with um, other illnesses, other epidemics before, and that's the approach that has a real possibility of bringing about containment and healing.